Here hanging out with Oscar. He seems like a normal cat, right? Just likes hanging out with me. He has diabetes, but it was scary at first, but I learned that it's not uh, a death sentence always, just like with humans. I talked to other people that had cats with diabetes, and some of them have lived like another 8 years. So we're starting the fourth year of this journey. He was diagnosed on September 8th of 2021. And I was going to show you a little spreadsheet. I keep track of his scores, and things have been more optimistic lately. Sometimes there is a chance where they could get off insulin, and there are days where he hits a normal number, so I skip insulin. And the reason why you do that is if you give insulin when you're normal, then you could go to a low blood sugar level, and there could be some pretty bad side effects, up to death that can happen. And I may do some more awareness on my channel about diabetic care, because I find like the veterinarians, people that I spoke to, they don't do the best care. Like they just say, give your cat insulin twice a day. They don't really tell you that you need to test, because you need to know what the score is, because just like with a human, the scores vary. I find like the diabetic care for humans is usually pretty good. They tell you test, and then you take insulin if you're at a safe level to do so. But they don't really do that with cats, and it's disappointing. They also don't really discuss the nutrition. I learned a lot over the years. Too much carbs, which a lot of dry food can cause, like diabetes and other health issues, of course, obesity and other things, because a lot of those foods, made in a factory, they're not going to be healthy. It can be like eating Burger King every day. And so I learned to switch Oscar, where's Oscar? He went to eat, to some more healthy of a wet type of food, like lower carb, like less than 5%. And maybe veterinarians don't want to tell people that because it costs more money than a bag of dry food. But maybe in the long run, you save money if you can prevent some terrible health issues for your cat or even your dog. But yeah, I have this spreadsheet, and maybe I'll do a video kind of show my routine of testing Oscar. But I started this in 2022. He actually had diabetes since September 8th of 2021. So we're kind of starting the fourth year. And, like some days, like look on October 23rd, if you could see an 85, which between 50 and 100, you're at a normal level. And the best case scenario, like if a cat or anyone that diabetic can be at a normal level for like 2 weeks, then they believe they're in like remission. It's possible it could come back and you got to do insulin again. But at that point, you can kind of back off on giving insulin and maybe test once a week and make sure it stays at a normal level. And so testing consists of, it's different than a human, where you either prick your finger and you have like a little lancet thing, that strip, and you get a score, or people have those things on their arm where they don't have to poke themselves. And you can do that for a cat or dog, depending how laid back they are. Some will just tear off the attachment onto them. And it's my understanding it lasts like 2 or 3 weeks. But I just do things, these strips are like 18 cents a piece. And this glucose monitor, it was only like $7. Walmart is pretty cheap. What I learned is if you buy equipment at the vet office, it's going to be like 40-60% more. So, you can go to Walmart, other places. I get insulin through a company in Canada, but there's different options out there instead of just buying it through the vet. And so, but but yeah, like you could see, like he hit 85 one day, and then one day he was at 115, which it's not quite normal. Like 50 to 100 is normal, but 115, I kind of err on the side of caution and not give insulin because, you know, if the insulin gets him below 50, there could potentially be side effects, and I don't want that to happen. So yeah, essentially I test him twice a day, and then if he's at, you know, like lately he's been like in the, you see like the 170s, 150, 180. So then I give insulin. I give around 3 units of insulin a day is kind of what seems to work best. And so he's really improved. Like you can see, this is kind of like color coordinated, like going back to like October, so like 3-4 weeks ago. He was in the yellows, like 230, 265, and he hit 324. And so now, like, he's hitting the blue, which isn't quite normal, but it's better. And just kind of scroll up, 311. So he's improved. When he was diagnosed in 2021, he was at 647. And then for the longest time, you can see in the spreadsheet, he's had a lot of 300 scores that frustrating. Even at the beginning, if I show you back in 2022, like he had 500 scores, and, you know, in the red over 400. So it's been a while since we hit that. But, you know, I changed to, you know, I kind of experiment with a few different brands of food and, you know, transition them off the dry food into wet food, and that seemed to make a difference. And then, you know, we're having a pretty dang good breakthrough that kind of gives me hope that, you know, I just assumed Oscar would be a lifer on insulin, but I think there's potential where he might be able to get back to normal. But you know, his quality of life, you know, like I'll show Oscar, like he's enjoying life, so I keep helping him out. He likes hanging out in my hoodie. It's kind of been his favorite spot, right, Oscar? And so I keep trying to help him. He is getting older. He's 12, and I actually got Oscar at an older age. Like he was rehomed because this lady's daughter got him, and then she got married, and then the mom is allergic to cats. So I got Oscar kind of through a friend's coworker, and I kind of knew when I got him. I was told he was 15 pounds, and then when she brought him over, he was 20. You could see he's not 20 pounds now. That was kind of part of, you know, he was exercising and stuff, and I thought he was losing maybe healthy weight, but there were some symptoms there with him drinking a lot of water and a lot of urination that I felt like maybe he has diabetes or something, and then that was confirmed back in 2021. He got down to 10.8 pounds. Now, last time I weighed him, he was like at 12.2 or 11.8, and he seems to be maintaining that, so I'm pleased there. I was really concerned when he just kept dropping weight because he was diagnosed when he was at 14.5, and then he got down to 10.8. I'm like, this can't continue. And part of diabetes, like when they get regulated, because their metabolism speeds up, or even though Oscar's always got a healthy appetite, that he's kind of more regulated. And now I think the vet would be impressed that, you know, he's not getting over 200, his score. So, and he's hitting a normal level maybe once a week, and then otherwise it seems like his score will be like 170, 180. So it's a lot better than 200s or 300s. That was kind of the norm for 3 years. So it's a little bit about diabetes. I might show kind of how the whole routine of testing is. Like I poke his ear to draw some blood, and then for whatever reason on a cat, they're, I just kind of use a Kleenex, and then, it's not like they need a band or anything. It just kind of dries up pretty quickly. And he's used to the routine, and, it's just a matter of maybe 5 or 7 minutes. I test him, and then he eats, and then I give him insulin. With cats, what you do is like their trusk, kind of behind, kind of like how a cat will hold their kittens. That's where you poke them, and it doesn't seem to be painful, because it's not going in the skin or muscle. It's like loose skin. The insulin gets through, but I'm pleased with how Oscar's doing, going into the 4th year of this. Any last words, Oscar? Just kind of chilling. There he is. Cool. Yeah, maybe I'll show a video of the routine of Oscar getting tested and insulin, and he's pretty cooperative overall, so I'm thankful for that, and he enjoys life. And most people wouldn't know he's diabetic by the way he behaves. Pretty energetic cat at 12. I know right now he's just kind of chilling, which is cool, but I think he's a happy cat. Make it a good day.